All right, I'm going to share my screen and we can get started. Thanks so much for joining us. This webinar is being hosted by the National Organization for Rare Disorders, aka NORD. We are a 40-plus-year-old patient advocacy organization that serves all people in the United States living with rare disease, and that is about 30 million people. This is our February Rare Action Network webinar, and because it's February, we are fully on board with all things Rare Disease Day. So you'll see from this PowerPoint, we've got our Rare Disease Day, Show Your Stripes slogan on here, and that is a call to action. We would love everybody wearing zebra stripes all throughout February, especially on February 28th to participate in recognizing and celebrating our community. NORD's mission is to improve the health and well-being of people with rare diseases by driving advances in care, research, and policy. And this is our agenda for today. We have a really exciting webinar for you. I have a few housekeeping items that I will get to in a moment. After that, I'll give you a brief overview of our state report card. That is a topic of our webinar today. And then our state policy team will walk you through the state report card in great detail. They'll show you how to navigate the state report card. They will walk you through all of the policy issue areas that are graded on our state report card. They'll show you how you can really use the state report card as a tool, because it is a living, breathing tool that is meant for all of you to use and to fuel your advocacy efforts in your state. And then I have a little Rare Disease Day State Advocacy Challenge for you that I will share at the very end, and we'll conclude with some Q&A. So going right back up to the top to housekeeping items, we will have, I think, sometime at the end for live Q&A. Please put your questions into the question and answer box. If you're looking at your Zoom screen, you'll see most likely a navigation bar on the bottom of your screen. And that's where you'll find the Q&A. It may be under the little three dots. You may need to click on that to find the Q&A. Please submit your questions there. If you put them in the chat, it's likely we will not see them, and we don't want to miss anybody's questions. Again, we do ask that you keep chats during the presentations to a minimum to avoid distracting other participants. You're welcome to introduce yourself in there right now. Maybe say where you're from, connect with others, and you're welcome to send private messages to people if you are looking to network. Last but not least, this webinar will be recorded and we will be sharing it out with all registered attendees after the conclusion of this virtual event. All right, so with that, I'm going to go onward. This is a lovely photo over here on the right-hand side of the screen of one of our amazing advocates, Mary Naden Scott, who is also an advocate for the Friedreich's Ataxia Research Alliance. And she's pictured here with a official at the Vermont State House. And NORD is going back to Vermont next week for our second kind of annual Rare Disease Day event. I just love this photo. They were really fantastic and such a great state for rare disease advocacy. All right, so quick overview of the state report card before I hand it over to our state team. The state report card is over a decade old now. It first launched in 2015, and it evaluates all 50 states plus DC across 9 critical policy areas. We'll dive into the policy areas a little bit later on. The latest version that we just published was compiled using data current as of 2025, December 2025. And it's important to note that the state report card is a snapshot in time. So it's current as of the end of last year. Last but not least, the state report card is a tool for all of you, patients, advocates, policymakers, to fuel your advocacy efforts. It's really a resource that we hope you come to love as much as we do and you utilize in all of your advocacy work. All right, so I am going to wrap up and pass it over to Carolyn Sheridan, our Associate Director of State Policy here at NORD, and she is going to walk us through the state report card.
Amazing. Thank you so much, Darby. Good afternoon, everybody. Happy Almost Rare Disease Day. My name is Carolyn Sheridan. I'm your Associate Director of State Policy here at NORD. I am joined today by my colleague Gretchen Frank, who leads our work on Medicaid policy in the states. As Darby mentioned, if you have questions as we go, drop them in the Q&A box and we'll answer them in the chat, or we can tackle them live at the end for the whole group. So what today is a tool training. We are showing you how to navigate and use NORD's state report card as an advocacy tool. So by the end of our time together today, you should be able to know how to find your state's grades, how to understand the issue pages and the rubrics, how to compare states to one another, how to download and use the data, and then how to use this in real advocacy meetings. So with that in mind, let's get into it. I'm going to be sharing my screen. And sorry, you're going to get me live messing on this one. Be patient with me. Okay. Share. Okay. I think you're going to be seeing my screen. Okay, here we go. So here is what you should be able to see. All right, so you should see a blank screen right now with a little red dot. That is our friend. Keep an eye on him throughout the presentation to help guide your eyes because this is going to be a live demo. So first of all, because it's a live demo, section 1, finding where it counts in your state. You can find the NORD state report card by going to rarediseases.org, which is NORD's main website. You're going to hover over driving policy, and you're then going to find the NORD state report card. Click, and you are there. This is NORD's state report card. For 10 years, we have been grading states on issues like step therapy protections, newborn screening, Medicaid eligibility, out-of-pocket costs, and other policies that determine whether you can access care, whether you can afford treatment, and whether you have a voice in your state government. So we're going to spend a few minutes together on this landing page, is what we call it. Right at the top of the page, right over here on the left-hand side, there will always be a link to bring you back to NORD's main home webpage. Simply click on NORD's logo and we'll end right back at our main homepage. To get back to the report card, we're going to go to driving policy and go to the NORD state report card. And here we are, we're back. Now let's look at what we're seeing on this page, right over to the left-hand side. Here, we were able to provide all of you with nationwide overall scores, as well as overall scores for each issue area. Nationwide, the United States earned a B on this year's report card. We have 4 A's, 25 B's, 22 C's, and no states scored a 0 or an F overall. As we scroll down, we're still keeping our eyes on the left-hand side. We're seeing a snapshot of some of the 2025 wins that we had. It's always important in policy to celebrate your wins. It is a marathon, it is not a sprint. So in 2025, we saw 3 new RDACs established. We saw 4 states ban copay accumulators. We saw step therapy reform in Alaska and New Jersey, 2 very distinctly different states, literally on opposite ends of the map from one another. We saw Illinois ban junk insurance, which we'll talk more about. And these are all really great. If we scroll down, we also wanted to be sure to pull out some areas of concern. After we put our report card together, it's a really great way to kind of check in and see what are some things that we need to keep an eye on going into 2026. So some areas of concern that we saw after this year. Not all states moved forward. We saw the state of Georgia cut parent Medicaid from 100% to 29% of the federal poverty line. And Gretchen will teach us a little bit more about what that might mean in practice. Massachusetts and Rhode Island limited retroactive Medicaid coverage gaps, leaving gaps in coverage. Federal enforcement of junk insurance plans or short-term limited duration plans are not prioritized under the current administration, so state protections are more important than ever. And we, of course, have the states mandated to implement Medicaid work requirements by 2027. And that's why, more than ever, state advocacy is critical right now. If you continue to scroll down, we are very happy that we can continue to be able to have patient stories populated on this page that are issue specific. And Darby's going to need your help with that, and she'll tell you a little bit more about that at the end. If we scroll back up to the top, we're going to turn our eyes to the center portion now. This gives you a little bit about what the report card is, how long we've been doing it, and what we hope you can all get from it. It is very important to note this line here. The latest edition of the state report card was compiled using data current as 2025 of December. This is a snapshot in time. The data is updated once a year, and then we use it as a benchmark for next year. So policies are going to change throughout the year, and they will be reflected in next year's report card. Okay, so now to get into what you're all actually here for, diving into the data for your state. And there are actually two ways to do that. Navigation option number 1 is to start with your state. I'm going to use Iowa as an example. So if I hover over the state of Iowa, we see that their overall grade across all 9 issue areas this year was a C. Click on Iowa. Deal with Carolyn's Wi-Fi connection. Oh no. Okay, here we go. Thank you for your patience, everybody. You click on Iowa and see what pops up. You get Iowa's overall grade with all 9 issue areas listed out and their grades right there. This is a simple list. Medicaid financial eligibility. Looks like Iowa got an A. Medical nutrition, we're at a C. Newborn screening, we've got an A. Prescription drug out-of-pocket costs, we got a B. Protecting patients in state Medicaid, unfortunately a failing grade. Protecting patients in state regulated insurance came in at a D. Rare disease advisory councils comes in at a no. Step therapy comes in at an A, which is great. And telehealth came in at a pass. This is your state's report card. It is a quick snapshot. You can print and download this information, just your state's report card, to use in your advocacy. But to understand what these grades mean and how they're determined, you are going to click into an issue area. So we're going to return to the NORD state report card page right here. And we are now going to go through into an issue area page. Navigation option number 2. I'm going to pick medical nutrition. So here's the issue page for medical nutrition. Do you notice what has changed here? This is no longer Iowa specific. This is the medical nutrition page nationwide. Our map, we have our, scrolling back up, we have our nationwide overall grade for medical nutrition specifically in the top left-hand corner. If we scroll down, we have the map view, which is color-coded and shows all 50 states plus DC, reading out each state's individual grade. We also have our educational content up at the top, which describes to you what the issue area is, why it matters to rare disease patients, and what NORD is grading in this area. And finally, if we scroll all the way to the bottom of the page, you can find that issue area's rubric, which will tell you how we went about grading that. So we then return to the main report card page. 2 navigation paths, state to issue from the state report card page to the issue page, or from issue to state. Both work and both make sense, whichever for what you're trying to do and for what your goals are. So what we're going to do next is walk through 2 to 3 issue pages in detail. We will show you what's on each page, and then we'll show you how to use it, and we will quickly tour the rest of the pages. It's important to note that all of the pages for the issues have the same structure. So once you understand how one reads from top to bottom, you'll know what you're getting on the other issue area slides. I really enjoy the area of medical nutrition. I think it's a really interesting policy area. So let's go on there. Once again, we're back to the medical nutrition area page, and let me show you what we're looking at. At this top section, nationwide overall grade C, that is relevant to medical nutrition as an area. All states, average grade is a C. So there's a lot of work that can be done in this space. What we have in bold here is NORD's position statement on that issue. This is the official position that NORD feels how this issue area ought to be dealt with in the states. The next section, so we scroll down, this is our educational content. What is medical nutrition? Why does it matter to rare disease patients? What are we measuring in this issue area, and how are we grading states? We scroll down and then we see the color-coded map. Every state has its grade showing up in its different color. You can also hover over them to get the readout in text of what the grade is for that state. You can click on any state to be brought to its state-specific page. You will see its grades in not only medical nutrition, but the rest of the issue areas as well. As we scroll to the bottom, we have a little bit more detailed information. This is for folks who really, really want to dive into this issue area and learn just a little bit more about it. All of the citations that we use to support the claims made in the educational section are here. You can go in and dive in and read those yourself. And then we also have our detailed grading rubric. So once again, coming back up to the top. The nationwide overall grades. This means that we have averaged all 50 states' grades together. The nation overall gets a C on this issue area. When you're looking at the map, the colors tell you what the grades are. So here, orange and blue states are our A's and the B's. They're doing really well in that area. Notice here, there's no A's. I'm seeing a lot in this area. I'm seeing a lot of yellows and purples. That sticks out to me as a pattern that there's a lot of work that needs to be done in this space. So let's say that you live in Iowa. Looks like there's a C grade for your state. Now we can look to some of its neighbors. Maybe Minnesota, for example, which has a B, or Wisconsin, which also has a C, or Nebraska, which is showing up as a D. That's your advocacy hook there. Wisconsin is right next door. They have a C. We can do better than them. Sometimes that works for some lawmakers. Other times what works is look at Minnesota. They have a B. It's working for them. Let's see how we can work too. There's also an example to be made going the other way. You're living in Iowa. Your neighbor is Illinois, who has a D. You can then point to that and say, our neighbor Illinois is doing this and we don't want to go backwards. Let's go forwards. Let's try to make progress in this area, not fall behind. And that all works a little bit. So if we scroll to the bottom though, this is really the most important part for understanding and using this tool, and that's the rubrics. Every single issue area has a rubric associated with it, and it always is at the bottom of the page. This shows you exactly how we as Nord staff come to the grades that we do. So if we click onto it, it becomes a little bit bigger so that we can read it. So clearly for this one, for medical nutrition, looks like Nord is grading across 1, 2, 3, 4 categories. We're looking at the coverage requirements. So we're looking at what is covered and who is covered in both the private insurance marketplace and state-run programs, which is like Medicaid programs. For each of these categories, you can get an A, a B, a C, a D, or an F. And the overall grade for that issue area is landed on by coming to an overall grade across those 4 components. So what is happening in real time is we are reading the laws on the books in that particular state, and we're putting them up against where they fall within this rubric. So a state that covers food and formula with no limitations in both the private insurance marketplace and the public insurance marketplace, that's an A across the board. They get an A overall in the medical nutrition area. Each category is weighted the same, so they're all equal. So it's not like having better coverage, it's not like having one is going to like outweigh the other one. So you can see exactly why your state got the grade that it did. Darby, could you speak to how somebody might actually use the rubric in an advocacy setting?
Absolutely. Thanks, Carolyn. If you don't mind scrolling back up to the map just for a moment, please. Thank you. So going back to what Carolyn was saying earlier about kind of leveraging your neighbor's grade as an opportunity to advocate for improvements in policy in your own state. I think a great example of that would be comparing, for medical nutrition, comparing Virginia and North Carolina. Virginia has a B overall grade and North Carolina has a D. So if I were an advocate from North Carolina, you're in a really good position to utilize your neighbor, Virginia, and meet with your lawmakers and talk to them about this issue. Use some of our talking points above about what medical nutrition is. Insert your personal story about why it's so important to you, how it impacts your life, and how it impacts all of the other people from North Carolina in the rare disease community. And then I would say, Virginia is doing a bit better than us in this space, and here are some of the differences. And I would reference the rubric down at the bottom that Carolyn shared to show the lawmaker or their staff that you're meeting with some of those differences. So maybe it's that there are there's less coverage in North Carolina, or maybe it's more restrictive, maybe it's not all conditions, maybe there's good coverage for people with private insurance, but not state-run programs. Whatever the scenario is, I would call out those specific discrepancies between a B grade and a D grade, and just advocate for the importance of improving the grade to benefit the rare disease community. And then I think it's really important for everybody to know that it is not your job as an advocate to be a policy expert. You don't need to be coming up with the policy solutions or concerning yourself with bill language, drafting language for the lawmakers or their staff. That is their job and their responsibility. And you've done so much legwork by bringing this to their attention and showing them the data on this issue. So that's really your primary job, to raise awareness and advocate, and really share your story so that way it becomes personal to them and they really understand how their constituents are being impacted, and they will do the legwork. That's the goal.
Absolutely. And I can say for a fact, and I assure all of you, that is a really powerful thing to bring to the table. If we continue exploring the page, we will find even more tools for you. The big one, do you see this button? Download data set. click it, a box will come up where you'll have to enter your information. We're going to ask for your name, we're going to ask for your email, and then we're going to ask for your connection to the rare disease community. And this is just so that we can make sure we know who is getting this information in case we ever need to push out an update or let, a correction has come through, we can share that with you. But if you click it, you all saw a download started. It's up here in the top portion. So I open my download.
While that's downloading, Carolyn, we got a great question in the chat that's very relevant to what we're covering right now. The question was, how can we effectively argue the relevance and trustworthiness of the rubric? I could see a lawmaker arguing that the rubric is not a sufficient measurement tool. And great question. You will see all of the sources cited on every single page right above the rubric. So fortunately for us, unfortunately for the lawmaker, if they're trying to prove the grade wrong, all of this and data is cited. So it's very challenging to contest that.
I'm gonna stop sharing for a moment and reshare so you can all see the download that happened. Here is our download. This gives you the full spreadsheet for that issue area. All 50 states plus DC, specific policy details, the content that we used to arrive at that grade. And every grade is backed up by actual policy documents, statutes, citations, and regulations. You can read the law yourself. You can bring this to the meetings. The lawmakers and their staff know how to read documents like this. They know what those citations mean. They can find those laws and regulations too. When a lawmaker says, "Where did you get this?" you should say, "Nord State Report Card." It's verified against Section 36A of insurance law. And here's the link to Nord's report card so they can find it. Other areas and other resources are also linked if we have found things in our review that have come up that aren't necessarily related to that law, but they are good for rare disease patients to know. For example, in Arkansas, here are the relevant provisions of medical nutrition law in Arkansas, but we also found that that state has a tax credit, and we provided the citation and the language of the law where that tax credit is spoken about. So that's here for folks to know. Every single issue area has a 50 state plus DC survey that you can download, you can print, and you can explore. You now should be seeing my report card screen again. So we're pausing to digest. That is a full walkthrough of one issue page. And every issue page has the same structure: nationwide grade, educational content, the color-coded map, rubric at the very bottom, your download button, and all of your sources. Gretchen, maybe we should show them just one more in detail. So how about Medicaid financial eligibility? I think it's kind of urgent right now.
Yeah, absolutely. Thanks, Carolyn. And hi, everyone. Thanks so much for joining us today. I'm excited to be back for another RAN webinar, especially this month as we get closer to Rare Disease Day. So looking at this page, we have the same structure, just a different issue, which is Medicaid financial eligibility. Once we can get there.
It's still loading. Sorry, everybody. There we go. Take it away, Gretchen.
Okay, so we have the nationwide grade, just like before, up on the top left. So that's a B for this issue. And then we have some educational content around what Medicaid is, why income eligibility matters, what we measure, the four population categories, which we can talk a little bit more about, and how we grade. And then there's a map showing all the states, and then a rubric at the bottom, like there has been with the other issue. So if we go back to the map, you might be able to notice a bit of a pattern. The orange and blue states, that those colors represent A's and B's. Those are mostly Medicaid expansion states. And then those purples, which are D's, those are mostly non-expansion states. Um, so just to give some context for expansion, the Affordable Care Act really paved the way for states to choose to expand Medicaid eligibility to a group of adults not eligible for Medicaid otherwise before because their income was too high. They didn't have children. They're not pregnant. So those adults that earn up to 138% of the federal poverty level. And that's allowed those states to catch a lot of adults that were previously falling through the coverage gap. So those that had incomes that were a little bit too high to qualify for Medicaid, but too low to qualify for marketplace plan subsidies. So that's what we refer to as Medicaid expansion. And research shows that Medicaid expansion has increased healthcare coverage, access, and utilization for thousands of Americans. And we know it's allowed many people with rare diseases to obtain healthcare. 40 states, all but 10, have chosen to expand Medicaid to this population so far. So that's just important for us to note because these are the states, along with two others that have partially expanded Medicaid through waivers, that are required to implement the work or also called community engagement requirements that are laid out in HR 1. So you can kind of hover over some of the states to demonstrate. Thanks, Carolyn. And just you're able to see their grades, and you can quickly compare expansion versus non-expansion. You can look at the different eligibility, Medicaid eligibility and grades with the neighboring states. You might be able to see some regional patterns there. And then if we scroll down to the rubric, there we go. And so we mentioned this rubric. Oh, thanks, Carolyn. That's perfect. Um, that evaluates four different population groups. So each gets graded based on income eligibility thresholds. And then the overall state grade combines all four. So we have parents of dependent children as one category, childless adults, that's the Medicaid expansion we were talking about, pregnant women, and then eligibility for children through CHIP. And to understand this category, you have to be familiar with the federal poverty level or FPL, sometimes called the federal poverty line. So those thresholds are dollar amounts set by the federal government to indicate based on that year what amount of money an individual or a family member needs to meet their basic needs. So 100% of the FPL would be the minimum dollar amount needed. Anything under that is considered in poverty. So then these numbers are then used, usually with percentages, as you see here, to determine eligibility for programs like Medicaid, SNAP, school lunch programs, and things like that. So, for example, this year, 2026, the federal poverty level for one person, so that's just the baseline, would be $15,960. That would be the annual income. So 138% of that would be about $22,025. So an adult would need to make that or less than that annually to qualify for Medicaid through expansion, in case that helps. So each category has specific federal poverty level thresholds for each grade. So you can see for childless adults here, an A would mean an expansion state, so eligibility at 138% FPL. And then an F would be a non-expansion state, so that would be no coverage for that group of people. Okay. And then I think there's some federal context on this page as well. Oh, yes. Thank you, Carolyn. So we have a critical 2025 update here that just talks a little bit about the federal policy changes ahead. Because HR1 will really reshape Medicaid completely. It's requiring those states to implement work requirements, enhanced verification for compliance and for exemptions for those work requirements, and then a lot of funding cuts. So this state report card really serves as a critical baseline before these changes take effect. The data that we have in here now shows where states stood before the federal changes, since those haven't been implemented yet. And then next year's report card will track the impact. So when you're advocating, you can say, before HR1, we had people covered at this level of the federal poverty level. Here's our baseline. We need to protect access. And you can also download this, just like the other pages. You get all 50 states' eligibility thresholds for each population. Um, and you can use that in advocacy as well. So you could say, for example, Iowa covers parents up to this percentage of the federal poverty level. Minnesota covers Y percentage. Our residents are falling through the cracks. We should expand like Minnesota did, and just be able to use that as an example. Oh, perfect. Thanks,
A lot
Carolyn,
of
for that.
numbers on that one.
Yeah. Yeah, so that is two full examples. So Carolyn, do you want to show them the other six just so that they can see the full tool?
Sure. And I'm going to auto load some of them, which for all of you, to do that, you can hover over, right click on your mouse and open it. And then you can open them separately in different tabs. But here we are at newborn screening, state programs that are screening newborns for all sorts of rare conditions. A really important issue area to be keeping an eye on here because there's a lot happening at the federal level here that states are really going to have to keep an eye on and potentially fill gaps for. Nationwide, though, we're coming in overall at a B. This is why this gives a little bit context of why we're particularly concerned about this issue area this year, and that's related to the Advisory Committee on Heritable Disorders in Newborns and Children. Pretty decent looking map, a lot of B's in this space, but you also have a number of C's, especially up in the plains regions. Once again, there is our rubric. So what are we grading in newborn screening? We're pretty much looking up against the recommended uniform screening panel and how aligned states are with the recommended uniform screening panel. So find your high performers, see what they're doing, see what they're not doing. And even if you are in a high performing state, that's something to be taking note of because that's your baseline. You don't want to go below what you're already at. So you know when you need to be protective. Our next issue area, prescription drug out-of-pocket costs. Looks like a nation overall grade of B here. And what we're actually looking at with this issue area is we're measuring whether states have enacted a certain number of 5 sets of policies that help limit the costs that patients are paying out of their own pocket for their prescription drugs. We're looking at deductibles and drug cost caps. We're looking at benefit plan design that's standardized. We're looking for annual drug cost limits and any copay accumulator bans, which we saw, remember from our landing page, we had 4 states enact a copay accumulator ban this year. Each of the 5 protections is weighted equally, and states receive a higher grade based on how many of these protections they have enacted. Any 3 are in place, and that state will receive an A. And it doesn't matter which mix of the 3, we just ask that you have 3. So once again, download the data set is available. Looks at some of these A's. So this is actually an interesting area to download the data for and to dive into because it's any mix of those 5, which means there's plenty of areas that your state might have some work to do in. because they might have that A, but maybe they don't have all five. If we move into the next issue area, this is, Gretchen will take this one, and protecting patients and state Medicaid programs.
Sure, thanks, Carolyn. So this one, there is some educational context here around Section 1115 waivers, but for anyone unfamiliar with that, states can make temporary changes to their Medicaid programs through a Section 1115 waiver. Section 1115 refers to Section 1115 of the Social Security Act, which allows HHS to waive certain provisions of the Medicaid Act so that states can implement kind of experimental, pilot, or demonstration projects. The projects have to be likely to promote the objectives of the Medicaid program. Um, but this is sort of like a permission slip for states to try new things that they wouldn't normally be allowed to cover through Medicaid and just test out new ideas and ways of dealing with problems. So many states use waivers to improve care, but some have used it to reduce benefits. Um, and the rubric for this one is a little different. It's pass fail,
Yep.
I believe. Okay. Yes, based on harmful provisions, basically. So if a state is trying to include premiums or coverage barriers in their waivers. So on the map here, the blue states are those that have failed. So those are the ones that have concerning waivers. And then the orange have passed. So there's nothing concerning in their waivers from our perspective. So the 42 Medicaid expansion and partial expansion states will be required to implement those work requirements by January 1st, 2027. But states have the option to implement those requirements early, and they can do that by submitting an 1115 waiver or through an amendment of their state plan, which is a written plan that kind of details the state's Medicaid program and how it's going to meet federal requirements. So the new work requirements are going to be really challenging for all states to implement in time for the deadline. And so a few states have noted intentions to implement early, which is even more concerning. So that's why it's so important for us to be tracking these waivers.
Absolutely. And that is why we are so glad to have you aboard, Gretchen. So we're going to go through the next couple ones. Before I do click through the remaining 4 areas here, this is a particularly good issue area to do a download of that data set for, because if you are in one of these blue states, the data set will tell you why it is blue, and you can read about what went into the grade for your failing grade. So protecting patients and state regulated insurance. This is a long name, but we are simply trying to capture information about what are called short-term limited duration health plans or junk insurance. Nationwide overall grade of C, another area where there could be some work done in this area. Why we keep an eye on this, these plans are not comprehensive health insurance plans. They can exclude individuals based on pre-existing conditions. So when we're grading states on this, we are trying to assess state restrictions on plan duration limits, renewability restrictions, and any sort of maximum duration that these plans can cover somebody for. So states that ban or heavily restrict these plans will have a higher grade, and states that have allowed them to proliferate and only use the federal rule as the controlling rule would get those lower grades, Fs and Ds. We have a lot of F and Ds in this area. 25 states have Fs. This is a major consumer protection gap and something that's really important to keep in mind as we're coming into this era of significant healthcare transformation. Rare disease advisory councils. This is not necessarily a letter grade area. This is simply yes or no. Our rare disease advisory councils give us all a community voice in state governments. We added 3 states to the RDAC community in 2025, so it was great to see those filled out. if you live in West Virginia, you will notice here your RDAC has expired and is now up on the block for elimination. There's an action alert live on NORD's website that we urge you to go in and take action on. It is in the very early days. So we want to try to make sure that our lawmakers can hear us on this and we can start those discussions to see that body preserved and strengthened and find a way forward for your council. Step therapy. This is a really great issue area. This is seeking nationwide overall grade here of B, so a lot of progress has been made. But this is something that insurance plans do where they ask patients to try and fail on different medicines than the one that their doctor initially prescribed for them before they can use the medication that they were ultimately initially just prescribed for in the first place. So we are grading states across 4 categories here. It's a good mix of where states are falling, but a lot of A's in this area. If you are looking to get into advocacy, this can be a really great area to be involved in. There's a lot of movement, there's a lot of voices in the space. And we've seen some great wins just in the last 2 years, which we'll go over really quickly. And finally, we are looking at telehealth. This is a simple pass-fail issue area. We have 43 states passing and 8 states failing. And what we're grading on in this area is related to something called the Interstate Medical Licensure Compact. And this really kind of streamlines care for across state lines. It makes it easier for doctors to become licensed in a state where they do not live. And for rare disease patients who often have to travel across state lines to receive care, this can really ease access to specialists and other providers. So now that you all know how to use this tool, I wanted to give you all a little bit of a quick inside look of how NORD uses this here inside every single day. So for those of you who are on our January webinar, welcome back. Thank you so much for coming back. If you were not with us, I did kind of give you all a little bit of insight into how NORD categorizes the thousands of bills that are moving through states. And it is kind of through this tiered system where there's an increasing level of engagement depending on where they fall. These 9 issue areas, the areas that are on the state report card, automatically fall into the analyzed level and are candidates for advocating and for engaging level. So when bills or regulatory activity happens in any of these areas, we automatically analyze and we automatically prepare to potentially engage on that bill in the state where it is. To give you a real example of how the tool moves from data to actual policy change, we have some really great examples from the step therapy area from 2024 and last year in the states of Vermont, New Jersey, and Alaska. And notice that the change all here, not everybody went to an A. Some states went to a B and some states went to a C, but all the states had a change. And that is where you have to get started. You're not always going to get all the way to the A on the first bill. Sometimes it is multiple bills. Sometimes it is a few years that you have to be at it before you finally get that ultimate A, but you've made progress. So in 2023, in the state of Vermont, when we were looking at the map of New England, we saw the mix of grades. Some states had protections in place, but Vermont was navy blue. It didn't have any of these protections. There were no meaningful step therapy protections in place there. And it wasn't just a color on the map. That was a signal for us. So it told us this is a gap. It told us this is a gap in a smaller state where change might be more achievable this year. And so what we ended up doing is we connected with our stakeholder partners and coalition partners from the Vermont Medical Society and the same coalition. We helped draft legislation. Advocates like you showed up in Vermont and activated and contacted their lawmakers Nord supported with testimony in person and virtually. Advocates showed up at a press event. And in 2024, Vermont signed into law H-66, which moved their grade from an F to a B. In 2025, very similar chain of events happening in New Jersey and in Alaska. So that's not just a shift, it's a real change for a lot of patients. And when one state moves, it creates momentum. Even now in 2026, another New England state, Rhode Island, has step therapy legislation that is going to be on the move this year. And that's how change spreads. A low grade identifies the gap, engagement drives the model, success becomes that, and momentum builds. And that's how we use the state report card. So here is your 3-step playbook, and then I'm going to hand it to Darby. And I really want this to be simple for all of you because we just walked through a lot of features and a lot of tools. But really the strategy is really straightforward. Using the report card comes down to 3 moves. Step 1, move number 1, you're going to identify the gap. You're going to go to your report cards page, you're going to review all of the 9 grades, and you're going to pick the lowest. Don't overanalyze it. Just take a scan. Where is your state struggling? Where do you see a C, a D, or an F? The lowest grade is not an opportunity. It's not a signal of failure, even though it's a failing grade. It's an opportunity. It tells you where policy change can really make a big difference for people, and that's your starting point. Your second move is to find your model. So you're going to go into the issue page. You're going to study the map and ID neighboring or similar states that have an A or a B grade. What protections do they have in place that your state doesn't? How does their state grade differ from your own? This is powerful because you're showing lawmakers that a solution exists and it's working somewhere. You're not just coming to the lawmaker with a problem. You're coming to the lawmaker with a problem and a recommended solution, which can be really, really helpful. So finally, you're going to build your case. You're going to download the data set. You're going to review the rubric, and you're going to click the source links and look at the actual law so that you get an understanding of what's going on. And now you understand exactly why your state has earned its grade and what could help improve it. And that is when the moment comes all together. We have a D, our neighbor has an A. Here's the rubric that shows the difference. Here's their law. Here's my story and why this matters to me. And let's pass this new law here. That is data-driven advocacy with receipts. And every single one of you can do it. So we're coming into the final portion here. And I do want to go back to our website and to the report card just one more time. And I'm sorry, Darby, I didn't know it was going to be so long here. But so we are going to go back to the website one more time. If you take anything else away from this, is I want you all to know that this is your tool and you're part of this system. And there are tangible takeaways and actions on this. And the biggest portion where that can come from, if you think something might be wrong, if you think information might be out of date or a law changed in your state, every page has a report a data error button. Click it and reach out and tell us what needs to be updated. That is you becoming eyes and ears on the ground in your state for Nord. You become part of the state policy team. Download and use the data set. Download buttons are on every single page. Bring it to your meetings, email to your reps, post it for Rare Disease Day. This will allow you to be specific. According to Nord's report card, we have blank on this issue area. And then finally, track the changes. When a policy changes in your state, good or bad, tell us. Did a new law pass? Was a waiver approved? Was a program cut? We can make notes of that. And you become then not just a user of this tool, but a contributor to the tool. And the tool only works if it is living and it's alive when you interact with it. So this isn't just a website, it's a living map of rare disease policy across the country. And the next step is really simple, and that is to use it. And that's where our grassroots team comes in. Darby, take it away.
Thanks, Carolyn. All right, I just have one slide to share with you all, so it'll be super quick. And you should be seeing it. It says take action in your state this Rare Disease Day, February 28th. So I'm going to share a really quick activation that we'll be sending out to our entire Rare Action Network as we approach Rare Disease Day. So we have these messages called action alerts. They're digital. And if you are signed up for our Rare Action Network, also known as RAN, you probably receive our action alerts to your email, and hopefully you participate in them. Those action alerts are a mechanism for you to reach out directly to your lawmaker. A lot of the time, we create a pre-populated message where you can share your story, and we have a wonderful system that knows who your lawmaker is based on zip code, and it sends the messages to your lawmakers. So we are getting ready to launch a huge portfolio of state-based action alerts so that all of you can drive impact along with us this Rare Disease Day. We're aiming for about a dozen action alerts that are related to specific bills that we are tracking across a variety of different states. And then we will also have one action alert that allows you to share your state report card with your lawmakers, which is really will be so fantastic because you can send it to them. Hopefully there's so many people in your state sending it to them, and they are going to be met with all of these 9 issue areas. You're going to see all the grades, and they're going to have access to all the information to understand the ranking and see how your state is performing. So we're aiming to have those live on 2/27, and we will send out an email to everybody that is part of the Rare Action Network to participate, and we'll be looking at engagement. So the states with the highest percentage of engaged advocates on our social channel are with the action alert, so the kind of proportionally the highest number of engaged advocates will receive the shout out on our social channels. So we hope all of you get competitive. And we really want to use this Rare Disease Day to build momentum that will spur legislative progress throughout the entire year. So think of this as like just the tip of the domino. And if you are not signed up for RAN, you will probably not get these emails with the action alert announcement. So I encourage all of you to scan this QR code to sign up for RAN if you are not, or you can go to our website under the Driving Policy tab to sign up for the Rare Action Network. And we are at 2 o'clock, but I have one more quick activation for you. I'm just going to pull this other browser in. If any of these issue areas really speak to your experience and your story, and you really want to be involved in advocacy around one of these particular areas, please send an email to us at stories@rarediseases.org. That's STORIES@rarediseases.org. We are very interested in updating our patient stories section here, and all of these little icons actually populate a story linked to a state report card issue area. So if somebody out there listening is really passionate about step therapy and it's had a big impact on your life, we really want to hear from you. We didn't get to questions, and I apologize about that. We will follow up with people who submitted questions to the Q&A function, and we will share this recording and the slides with everybody. Thank you so much for joining us, and I hope you have a wonderful rest of your day. Thanks, everyone.
Bye, everybody.